Melphalan is probably one of the most powerful drugs that we have in the field of multiple myeloma. It was discovered all the way back in the 50s as a derivative of mustard gas. It was tested in different types of cancers, and myeloma was found to be one of the cancers where this drug actually has an anti-tumor effect. For a long time, it was given at lower doses. It took all the way to 1983 when a research letter was published in The Lancet showing that high dose of Melphalan could lead to a deeper response. There were a very small number of patients included in the first study. Some of them were newly diagnosed and some of them had been previously treated. And out of the patients treated, only 3 or so patients that had a response, and these were newly diagnosed patients. There were follow-up studies done here in the United States by Dr. Barloghy, who explored it further in relapse patients. It didn't really work out. So all the eggs are put in the same basket, namely to go after the newly diagnosed patients. And looking through the literature, there are very many studies that have explored transplant for years in the setting of the available induction therapies. Many of them show progression-free survival benefits, if not all, but only some of them show overall survival benefits. So the question is, where are we in 2021? I think with MRD negativity being achieved with the newer therapies, the question is clearly there. We really need to add Melphalan. And now in 2021, the most recent review paper shows that there are multiple studies that have been published indicating that Melphalan increases the mutational burden with more than 20%. So adding a drug that causes severe DNA damage across different types of cells in the body, is that really the way to go? I think there are a lot of mechanistic questions that we still don't have the answer to. To what degree do these mutations lead to new problems? We know MDS and AML are significantly increased on a relative risk note, although the absolute risk is not very high. But I think there will be more focus on this in the future as patients continue to live long.